and happy February 2026. And welcome to episode 6 of Zooming into Focus, a podcast that explores and highlights the research and training developed by the Virginia Commonwealth University Rehabilitation Research and Training Center on the employment of persons with intellectual and developmental disabilities project. I'm your host, as always, Lucian Friel from VCU RRTC. On this episode, we will be talking with the principal investigator of Research Study 5, Dr. Carol Schall. Dr. Schall is the co-director of the VCU Autism Center for Education, the principal investigator of the Virginia Autism Resource Center, and the researcher in the grant, The Effect of 9-Month Internship Intervention for Military Dependents with ASD. She has over 30 years of experience supporting adolescents and adults with ASD as a teacher, group home supervisor, administrator, researcher, and consultant. Carol provided positive behavior support consultation and instructional technical assistance for the project Search Plus ASD supports program for the past 8 years at VCU. Carol was also the research coordinator for the project. She is a state trainer for the Positive Behavior Support Project with the Partnership for People with Disabilities at VCU. In Research Study 5, Dr. Schall and her team will be working to increase the quality of supported employment services provided to people with IDD by establishing a valid and reliable scale for implementation. And she's here to talk about it. Welcome to the podcast, Carol.
Thanks, Lucian. Good to see you.
Good to see you too. How is your first part of 2026 going?
Yeah, Happy New Year. It's going great. I actually took a little vacation to the Caribbean. I went to the Riviera Maya and stayed in a wonderful resort that had Mayan ruins and lots of pools and sun and warm weather. It's kind of hard to come back to cold Virginia, but Valentine's Day is on the move, so pretty soon we'll have some fun with Valentine's Day and lots of chocolate. So happy Valentine's Day as well.
Absolutely. Happy Valentine's Day. So let's jump up into your study really quick. Let's dive in. Can you tell us about your study?
Yeah, so it's a really important study and it's long overdue. We have research on the efficacy of supported employment for people with intellectual and developmental disabilities for over 40 years now. But we don't have any kind of checklist, scale, way of determining high quality practices. And so in research, when we apply high quality supported employment, we see tremendously good outcomes for people with intellectual and developmental disabilities. For example, somewhere between 70 to 80% of people seeking employment actually gain employment as a result of receiving high quality research based supported employment. However, when we look at the data in the field, we see much lower supported employment outcomes. In the field itself, kind of, for lack of a better term, in the wild, what we see is people who receive supported employment gain employment only about 50% of the time. And so that difference between about 70% in research and 50% is what we call the research to practice gap. Literally, that when you're looking at a difference of 20 points, and in real lives, that's 20% of people who could be working that don't attain employment. So the purpose of this study, RS5, is to develop and test a fidelity scale that we could take out into the community to help agencies that are providing supported employment provide high quality supported employment. And so that we could also use this as a checklist to let people know that this is what they should be looking for when they're seeking supported employment. It's a really important study, and I think having that fidelity check will overall improve our outcomes in the field.
Excellent. And for those of us not in the research field, what exactly is a fidelity scale?
A fidelity scale is really simple. It is a scale that you rate yourself as an agency on how well you do something. So think about it this way. Imagine that you were looking for a fidelity scale on riding a bike. And you think, oh, riding a bike is pretty simple. You just get on the bike and you pedal and you go. Well, there are a lot of component steps that if you get any one of them wrong, it's not going to work out so well. So if you're among the first steps is making sure your bicycle seat is at the proper height. And so if you're jumping on a bike and the seat is not at the proper height, it's going to be hard for you to pedal and to get going. And so on the fidelity list, we would say, place your bicycle seat at the proper height. Next, affix your feet to the pedals. Next, hold on to the handlebars. Next, start to pedal, gain momentum. And so if any of those steps goes wrong, then that's going to impact your outcome of whether you're riding that bike or falling over on the side of the road. Likewise, with supported employment, we want a fidelity scale that lists what should you do if you're delivering supported employment. And what we really want to have in that fidelity scale are the essential steps. What are the things that if you don't have these, you're not going to get a good outcome? And, without that, who knows what people are doing in the field? Do we really have an intervention that results in high rates of employment, or is 50% acceptable for us? And I would say 50% of people who want to work are not working. That's not a good outcome. In any other population, we would be appalled and really worried, and we would call that a depression, not just a recession. 50% employment, that's a depression. And so think of it that way. We need to increase everyone's um, skills so that we don't have an incidence where we fall into a depression for people with IDD.
Yeah, those great points that you're bringing up and great relating that. How did you all come up with a concept for the study? I know you're talking about the need for that and the gap, right? But basically, why are we conducting this study?
Well, so we're conducting this study because we need to increase the quality of practices across the field. We know that supported employment works. We know that supported employment results in better outcomes for people with IDD, but we need that to work everywhere that people live. Most people with IDD do not live right next door to a research university like VCU, where they can access employment specialists who have high levels of training and are really ready to implement this service. So we really want those experiences to be available to everybody, whether they're in Ottumwa, Iowa, Richmond, Virginia, New York City, anywhere that they live. And so that's really what we want to do is we want to use this fidelity scale, if I can use another metaphor. We talked about the research, the research to practice gap. We want this fidelity scale to be the bridge between those. How do we close that gap? We increase the skills of the people who are delivering supported employment. And so really that's what we're working on is making sure that we have really good indicators that agencies that provide supported employment can look at and then know whether or not they're meeting the standard. From an agency perspective, most people who receive supported employment receive that from, a community-based services agency. And when we provide good supported employment, we want that agency to be able to use this fidelity scale and say, well, gosh, we do a really good job on intake, but we're struggling to create the job seeker profile. And we could use more training there. And by getting more training and maybe even some coaching, then we would provide better services to people with IDD. We shouldn't have only 50% outcomes in employment. When you think about the money that's spent on supported employment, we're talking about tens, if not hundreds of millions of dollars a year that's provided in direct services to people with IDD who want to work, who can work, and who just need the help of a job coach to get to work. We shouldn't be okay with 50% outcomes. In any other, like I said earlier, that would be a depression if it were for any other population. But it's also a failing grade. 50% is not a passing grade. We are failing our fellow brothers and sisters and citizens with intellectual and developmental disabilities when we don't provide them high quality services. 50% is not an acceptable grade. So we need to raise the bar for everyone. And so that's really the goal of the study, is to make sure that we are doing that. If you wanted, I could talk a little bit about what we're learning, because in order to develop that fidelity scale, we really have to think about, so what is supported employment? And so we're running focus groups right now, and we're interviewing job coaches, we're interviewing vocational rehabilitation counselors, and we're interviewing people with intellectual and developmental disabilities to help us define what are the essential components of supported employment. And we're finding out a lot of things beyond what you would think. Like, a lot of agencies use more than one person to deliver this service. They might have someone who's a vocational evaluator who does the evaluation of the person. They might have someone else who helps the person find a job. Usually they call that person a job developer. And then finally, they bring a job coach in once the person is working. Well, almost everyone that we've talked to, from VR counselors to agency representatives to people with disabilities, say that's not a really efficient way to do this. That instead, what we really should be doing is have one person who's trained in all of those areas. Because what happens is, if I'm the person who's receiving those services from three different people, the information that the first person got has to be transitioned to the second person. And in that transition, there's some pieces of information that are lost in translation, and we don't get quality jobs as a result. And so one of the things that we've learned so far is that it's better if you only have one job coach assigned to a person all the way through. Now, that said, of course, people go on vacation. I just went on one. They get sick. And so there are some caveats there. But the point of this is, instead of having multiple people follow that case, we need one well-trained job coach who can do all of those pieces and parts.
And that makes perfect sense too. I mean, you think about like the comfort level that a person has, and you're developing that relationship between job coach and person with a disability trying to get a job. I mean, I would feel like, man, I'm getting, passed around here, like person to
Yeah.
person. So like, I think that's probably another big part of that, would you say? That just that relationship development part?
Oh my gosh, you hit on one of the other key factors that we found. Relationships are key here. It's often been said that you don't get a job based on what you know, it's who you know. And you're exactly right, Lucian, that if we are working with someone and they don't trust us and they don't really know well, like what we're doing, and if they just met us, there's low trust. And those relationships, not only with the individual with IDD, but with the business, with the employer who hired that person. That job coach has to have relationships with everyone who supports that person to make sure that this is a successful service. And you're exactly right. The feeling of being passed around is never good. We've all been to the doctor where we thought we were seeing Dr. I don't know, McGillicuddy, and then all at once we're seeing Dr. Smith, and we're like, who are you? Why are you here? I don't even know you, you know? And So that feeling of being passed around is not a good one and doesn't result in good services. And yet that's what we're doing right now to people with intellectual disabilities who are seeking employment. It's not good practice.
Right. And, going back to that number that you said, the 50%, I mean, it's not only, as you said, appalling, but it's just so eye-opening that it's that, much of a gap for people that are not getting employed. And as you said, like, it seems like the funds are there, but, we gotta get the quality up a little bit.
Yeah. Yeah,
Um,
that's right.
so this is sort of a two-part question. I know we're talking about employment specialists, but how were they the the job coaches that you're going to be kind of following around or surveying? How were they recruited or selected? And then how are you all measuring and collecting the data?
Well, we're going to be in the field quite a bit. We're going to be looking for. So let me also just back up a step and add some context. So job coaches are hired by what we call employment service organizations. These are generally speaking private organizations that access and provide job coaching services, and the people that they serve are referred to them from the vocational rehabilitation system. So every state has a vocational rehabilitation state office. Those offices manage basically the cases and they fund the service. And so the first step is to work with those vocational rehabilitation offices at the local level so that they know what quality supported employment is. And that's another thing that we're learning from our interviews. Different states have so many different definitions. It's time to standardize all of that to what works. Then we need to then go to the employment services organizations, these private vendors that provide supported employment services. And we have to ask them, can we come in and meet with you? Can we interview your job coaches? Can we talk with you about how you do what you do? And that is where we're really going to begin to see how this fidelity scale works. And we have to keep it both thorough, but also simple. We can't have a scale that is nobody wants to use because it's too hard to figure out what it is you're looking at or how you're doing it. And so the real, I think, elegance of this study is going to be the development of that scale. We already know certain elements of it. We know that there are things that job coaches need to do. We know that job coaches need to have basically two sets of skills. They have to be very skilled in supporting people with intellectual disabilities at work, but they also need to have high degrees of skills in terms of coordinating with businesses and speak the language of business. Business doesn't exist to provide a service. We are not helping people find jobs as a charity. We are trying to provide a workforce solution. I don't know how often you've been to, I don't know, a local business and they complain and they say, you just can't find good help anymore, right? Well, people with intellectual and developmental disabilities are excellent employees. And so we're not looking for businesses to hire them because they want to feel good or they want to offer a charity. No, we want instead for a business to see a person not as a disability, but as an employee who contributes to their bottom line, and understand that by hiring that person, they are going to get an excellent worker. That worker, if they have specialized needs in terms of learning, will have a job coach that assists them in learning their job. That worker will come to them, and the data suggests that people with intellectual and developmental disabilities are very dedicated and loyal workers. They are there at work every day. They don't like to miss as a group. And we have also done research and found out that businesses report that hiring individuals with intellectual and developmental disabilities actually increases morale at work. And, suddenly you're including someone in your work environment who's different than everybody else. And so imagine that I don't know, you work wherever you work, at a university, in a law office, at a hospital, and suddenly you have someone who's a little different than the rest of your coworkers, who brings a certain, I don't know, spark to the way you work together. That's going to be a really important aspect of this, is convincing employers that this is good business. This isn't just being nice. This is good business. It is good business to say, you know what? I have an employment need. There are all these people who are looking for jobs. That's a match made in heaven. Let's get these groups together and figure out the next steps.
Absolutely. So how are we involving individuals with IDD in this study? We've talked with all of the other principal investigators, and we've talked with Jen, the project director, about how we've included individuals with IDD in each of the studies. Can you talk a little bit about that?
First, we're including people with IDD in our planning. And so when we meet and when we are laying out the steps that we're going to follow to complete this research, we are including one of our colleagues with IDD, and then we have two advisory council members who join us in these meetings and help us ensure that we're taking into account their voice. Secondly, in the preparation of this fidelity scale, we completed focus groups with people with IDD. In fact, we completed 5 focus groups, and I don't remember the exact number of how many people were in those, but I know we set our goal at about 50. And actually, let me take that back. We did 10 focus groups. You know, even including people with IDD with focus groups, we adjusted our methodology. Usually, when you do a focus group, you want 8 to 10 people in the focus group, and you want to have about 5 focus groups. But because we know that people with IDD might need additional supports, it might take them a little more time to conceptualize the words that they want to use to describe what they're looking for, or it might be overwhelming to be in a bigger group. We made these focus groups smaller. So instead of going with 8 to 10 people, we went with 4 to 5 people. We cut it in half. And so we did 10 focus groups with 4 to 5 people. And that's one of the ways that we wanted to make sure that from the very beginning, as we develop this fidelity scale, we have it centered in the voice and the needs of people with IDD who have received job coaching or who want to receive job coaching to get a job. And so that, I think that's a really important point, that we want to make sure that we get that perspective. Like, VR counselors, when we held their focus groups, they were all about, well, you know, we interview everybody, we collect up, you know, we send people to psychologists to get new diagnoses. The people with IDD said, we're tired of going to psychologists. If you don't know yet that we have a developmental disability, that's on you. So stop
Right.
sending us to psychologists. You know, get to know us personally, figure out who we are, and help us identify the best jobs for what we want to accomplish in our lives. And so, a lot of the ways that we're incorporating voice is to make sure that at every step of the way, people with IDD are centered in our work.
That's excellent. I think, that's one of the things that one of the common threads for each one of these interviews that we've done so far on this podcast is that the importance of including people with the lived experience in this research is such a huge value to the end results. We hope you're enjoying this edition of the podcast. If you have any questions for us, you can head over to idd.vcurrtc.org/ask to submit your questions. One of our technical assistance team members or our training team members will respond back to you. If you have questions about anything related to employment for individuals with intellectual and developmental disabilities, you can submit it there. Or if you'd like to be connected to some of our different training options or some of our different resources, you can also ask your questions there. And now back to the podcast. I've got a couple more questions. What types of barriers are the most common for people with IDD in getting quality supported employment services?
Well, unfortunately, it's a confusing system. When people with IDD go to school, elementary, middle, high school, when they're in the public school system, it's a one-stop shop. Everything that you need is going to come through that school system. If you need physical therapy, occupational therapy, speech therapy, if you need additional reading support, if you need adaptive devices, if you need, a wheelchair, all of that comes from school. There might be some supports that you get from your doctor, but for the most part, your doctor is saying, go to the school, talk to them. They'll help you meet those needs. Once that person transitions out of school and into adulthood, there are different agencies for everything single thing you might need. If a family is planning long term for where someone will live, they need to go to the Developmental Disabilities Agency. If an individual is seeking employment, they need to go to the Vocational Rehabilitation agency in their state. If they want to receive services, then they have to go to another agency. And so it feels, again, we talked earlier about how awful that handoff is. It feels like people just go from door to door to door and they keep knocking, figuratively knocking, maybe calling, maybe emailing, but they keep knocking on doors and saying, can I get service here? Can I get service there? How do I get disability benefits? How do I get, and so it feels, I think, from the perspective of the people that we've heard, it feels very confusing. Like, why isn't there one place? Consider this. Most of us go to doctors now that live within entire health systems. And so if I go to a doctor and the doctor says, well, I see this little thing, I think you ought to go to this specialist, the specialist is in the system and my medical record automatically transfers over, right? And so when I see that specialist, the first thing is that the specialist is reviewing the record and saying, oh, I see here that you take this medicine and you are on this exercise program and you've had these medical things done. So literally, my medical record follows me, right? Well, for people with IDD, none of those records follow to all these different offices. Imagine how exhausting it must be to knock on a door to say, am I qualified for services? And each individual agency has different qualifications. And so you think you have everything. You've packed up your portfolio and you have your last IEP from high school. And then you have your psychological that the psychologist at school did. And you have, your statement from the Social Security office showing whether or not you get Social Security disability benefits, and on and on and on. You have your folder, but you find out that this agency needs another piece of paper. And so you have to go somewhere else to get that paper. And so, from the perspective of the person with IDD, it feels like all they're ever doing is proving to people that they need the service. And so, from a systemic perspective, I think it would be really important for us to consider how do we make that go better for them? How do we make these records more transferable, more across the board available, so that, with a couple of clicks of the button and protecting people's privacy, ensuring that that data is confidential, all of that, yes, that should be a given. But also, when you're seeking help, you shouldn't have to jump through all these hoops. And so making sure that we make that system more friendly, more person-centered, and more aware of the experience of the person with IDD. Also, I think there's a really important thing that happens for people with IDD making the transition from college or from school to adult life. Most of school is based on what you don't do well. And so you get services when you don't do well. And so the whole system is built to measure how different you are from everyone else. Well, when the person comes to seek employment, we don't want to know that. What we want to know is, what do you like to do? What do you do well? If you think about this from your own experience, I was terrible in high school in chemistry. Hated it, never understood it, didn't like it, complained about it, scraped by with the very lowest grade that I could afford without, altogether failing, begged the teacher one day in tears saying, "Please, what do I have to do to get a C? My parents will be so mad if I get a D." Notice that I'm not a chemist.
Right. Neither am I.
Nobody picks their career based on what they don't do well. But that's what we do to people with disabilities, right? We say, gee, you don't do this well. Maybe you should, maybe we should have you do more of that until you learn it. You've got to learn it. And so the other thing that we do for people with disabilities when they come into employment is we want to work from a strengths-based perspective. What do you do well? What do you like to do? And then in that context, what are your support needs? We use the acronym SPIN when we're teaching people. What should they look for when they're helping somebody with IDD gain employment? And SPIN stands for, the S is strengths, the P is preferences, the I is interests, and the N are needs. So strengths, preferences, interests, and needs, those four. The reason that SPIN is important is because that's the basis of a job. When you first graduated from high school, no one looked at you and said, you should do more of the thing you hated. They said, no, you should follow your strengths, follow your interests. What do you prefer to do? How do you prefer your work to go? How do you prefer your life to be? And what do you need to be successful, right? That's like everybody else. And so we're not doing really revolutionary things here. We're doing what we know works for everybody else. So,
That's excellent. Um, with that, what are some of the key predictors of success for people with IDD using supported employment and vocational rehabilitative services?
so far, one of the things that we're finding is one of the keys is that job seeker profile, not an assessment, but a profile. And that profile, guess what that's filled with? The person's spin, right?
Right, right.
Their interests, their preferences, their needs, their strengths, all of that is in the profile. And then we're looking at job match. Here, when now we've gotten to know the person, we've like spent time with them, we've taken them to different jobs, we've had them try out jobs, we've worked with them to learn what really makes them tick, what makes them excited. Then we're looking for a job, and we want two things in that job. We want to make sure that that job is capitalizing on their spin, but also that that job has a culture that is inviting and inclusive. Um, I went to see a woman, and it wasn't here in Virginia, it was in another state, but this young woman was an extremely dedicated worker. She worked at a local McDonald's, and that local McDonald's kind of didn't really welcome her into that environment. They had her working in this tiny corner, and she needed some very simple visual supports. Like we made a series of pictures to show her, and her job there was to make breakfast burritos, to wrap the food inside the burrito and then package the burrito so that it was ready to be served to customers, and then also building the boxes that the Happy Meals go in and making sure each Happy Meal got a toy. And she was so organized. I mean, she would go into work in a 4-hour shift. She would make close to, 800 Happy Meal boxes and 500 breakfast burritos. But the environment, the culture there didn't welcome her. So whenever we put up picture lists to let her know how many burritos should she make, how many boxes should she build, Those lists were torn down. Also, her coworkers would constantly bump into her, and we began to think that this was a little bit of bullying. She was a person who doesn't use words very effectively, but she's a very dedicated worker. She wasn't welcomed in that environment. So it's not only that the job matches the skill set, but it's also the environment. And by the way, there are other McDonald's that do this very well. It just so happened that this particular store in this state had an issue. So it's not McDonald's,
Right.
it's the mix of people, right? She gets a new job in a new place, and I can't tell you the difference. She is so happy. She is so fully included. They celebrate her birthday. They have special corners for her to put her things. When she comes in, she gets to work every morning. And this is something we had to teach her, by the way, which is really interesting. Um, she would get in and start working right away, not realizing that it was 15 minutes before her shift started. And so she was clocking in early, which made it confusing in terms of payroll and records and all of that. And so we had to teach her when you come in, and we had to set an alarm on her smartwatch to let her know when she should clock in and start work. And then we had to create a space for her that had puzzle books for her to do while she was waiting for her shift to begin. She was so excited to start work. She was starting early. When you think of the perfect employee, that's who you're thinking of. The person who can't wait to get to work and start work early. And so they welcomed her in. They gave her a space. They let her store puzzle books there so that when she has time, when she's taking a break or when she gets in the morning, she can do those puzzle books. Her alarm rings, she gets right on the floor and gets right to work. And she's like literally almost skipping to work. She's so excited to work. That's the kind of environment that we're looking for, an environment that says, you know what? You're one of my coworkers. Doesn't matter if you don't talk the same way I do, or you do. She loves word searches. You do word searches. I sit and do stupid puzzles on my phone. Doesn't matter. We're all just coworkers, and we're all in this together, and we all have something to offer to everybody. So that's what we're looking for in the wider business community, is not just a job match that matches skill sets, but a culture that welcomes the person with disability as a fully contributing member of the team.
Right. I mean, that's gosh, what a big part of making sure that you're successful at your job and that you like your job, right? The environment. As you were talking about that, I was like, I like working here at RRTC. Like I've got we do birthday stuff and potlucks and all that good stuff and that,
And Spirit Week.
and
Remember
Spirit Week.
Spirit Week,
Yep,
Lucian?
yeah. Always a good time.
Yeah.
Third one coming up this year.
That's right. That's right. Yeah, when you think about the things that make your job, like everybody is going to have a frustrating day at work. Everybody. Everybody is going to have a day where they leave and they think, "Ugh, why am I doing this?" Ultimately, what keeps us engaged in our places of work are our coworkers. It's, yes, you might have a coworker that you don't like. You might have a conflict here and there, but if by and large we like acknowledge we're all in this together, we're a team, we have a mission, and it doesn't matter whether that mission is serving a breakfast burrito to a customer who's hungry, or I don't know, creating the next medical breakthrough. If your team is not well coordinated, happy, and joyful about their work, it's really going to rub off on you. And so that's when we're looking at those places of work, we're looking for that culture match as well as the skill match.
Right, and you see it kind of anywhere you go with businesses when you're greeted by an employee that's, super happy and super delighted and just kind of chit chats with you a little bit. You can tell that that work environment has some good culture within it, and that's seems to be such a huge part of employment success. And so, with that kind of tying everything back to the study, how do you think the project will impact the field of vocational rehabilitation and also people with intellectual and developmental disabilities overall?
Well, what I hope we get out of this is a really good list of skills that will make a real difference in the field and in the lives of people with disabilities. We're actually working with national agencies or organizations. First, we're working with the Association of Persons Supporting Employment First, or APSE. And then we're also working with the Council of State Administrators of Vocational Rehabilitation to disseminate the findings of this study so that across this country, if vocational rehabilitation counselors know what good supported employment is, they're going to refer people to those agencies. Those agencies are going to be able to deliver quality services. And ultimately, quality services should result in better outcomes for people with IDD. You know, the employment rate for people with IDD has been so depressingly low for so long. We have to shake up the field and figure out new ways to help people find employment. We need these workers. We need highly skilled, talented, high quality workers. Just because a person has an intellectual or developmental disability doesn't mean that they can't contribute. I'll leave you with at least one final story, if not a couple more.
Absolutely.
Um, you know, we were working in a hospital setting with one of our folks who was encountering difficulties finding a job. So he gets a job. He happens to be a person with autism who has a lot of skill in organizing environments. The job he got was in a hospital pharmacy, and his job in that pharmacy was to pull out of date meds, put the meds in the bins in order of the soonest to expire to the latest to expire, and make sure that all of the medicines were in the right bin. You know, if you've ever seen a hospital pharmacy, you would understand what a big undertaking this is. First of all, hospital pharmacies have more drugs than any other place in any other pharmacy. It's much, much larger than your local pharmacy in your community. Also, each medicine is individually bubble packed. So you don't have a bottle of aspirin. You have, thousands of individually packed aspirins in little bubble packs. Okay? Each of those pills has an expiration date. And so any hospital pharmacy easily has millions of individually bubble packed pills. Some of these are liquid medicines in individually packed, liquid containers. They are all designed to only last a certain amount of time. And if a hospital delivers an expired medicine to you, that's a medicine error that they have to report to their accrediting board. Well, this young man gets hired by this hospital, and he is so dedicated to his work that he had that hospital in perfect order within 2 months. Not only that, they decreased medication errors in that hospital by over 50%.
Wow. Wow.
I mean, imagine that. And prior to hiring him, that was a job that was done by the hospital pharmacists and pharmacy techs when they had time. And so you're moving quickly through your day, you're grabbing a medicine, you're realizing, oh, that's the wrong medicine. You put it back, but you put it back in the wrong bin. That's a medication error waiting to happen. The medicines get all jumbled and all mixed up. You're moving by quickly, you knock the bin off the shelf, medicines fall everywhere. Those are medication errors waiting to happen. And so you bring someone in with a developmental disability who's going to be really focused and really detailed and make sure everything is in order. Every single pill is where it's supposed to be. All of the expired pills are pulled and discarded. Suddenly your entire operation runs more smoothly. And your highly trained staff, your pharmacists and pharmacy techs, are freed up to do what they're trained to do, which is make sure that they're giving people the medicines that they need. So that's a win-win for everybody. Disability or not, that person has changed the way medicine is, the quality of medicine that's provided. And, patients will never see him, but I want to go to that hospital if I ever need healthcare services because I want to know that my medicines are in the right order.
Absolutely. And that's a great example, like just of a person not just doing a job, but making the business better and run smoother. And as you've said, people with intellectual and developmental disabilities are great for employment for things like that, for uplifting not just spirits, but uplifting the productivity of the business.
Yeah, if I work there in that hospital and I know that person has gone through and the meds are in order, it takes a weight off of my shoulders as I'm going through. I'm not constantly like second guessing myself because one pill looks like another. We've
Right.
all had that moment. If you've ever dropped your pill box and you're like, "Oh no, I got to figure
Right.
out what goes where." Yeah.
Well, 50%, I mean, decreasing the errors by 50%. I hope that employee got a nice raise there.
Well, he's been employed for over 10 years now.
Oh,
Um,
excellent. That's
well
great.
over 10 years. Yeah. Yeah. Which is just a fantastic outcome as well. That, they have a good worker. He loves his job. Loves his job. And that's what we want.
Excellent. Well, Carol, thank you so much for helping us zoom into focus on your project study here, research study 5, in increasing the quality of supported employment for uh, individuals with intellectual and developmental disabilities. I hope that you'll come back on with us, if not later on this year, maybe a little bit next year, and fill us in on all the great stuff that's happening out there. And for next episode, we'll actually be interviewing Troy Carter, who is an employee here at the RRTC with lived experience. And so he'll be guiding us through his employment journey as well to get to this wonderful place of RRTC. And so, again, thank you so much for joining us and telling us all about the study, Carol.
Thanks, Lucian. Take care.
Thank you. Thank you so much. And thank you all for joining us today. The contents of this podcast were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, Neidler Grant Number 90RTE M0013. Neidler is a center within the Administration for Community Living, the ACL, Department of Health and Human Services, HHS. The contents of this podcast do not necessarily represent the policy of Neidler, ACL, HHS, and you should not assume endorsement by the federal government. Again, thank you for joining us.